Recognizing and responding to parental distress in pediatric surgical settings. When a child heads to the operating room, the emotional state of the parent often sets the tone for the whole experience. Today, we'll explore why parental distress matters, how it affects the child's recovery, and most importantly, what every clinician can do to recognize and respond effectively. Research shows that 30 to 45% of parents report moderate to severe anxiety before a planned operation, and the figure climbs to over 60% for urgent or complex surgeries. That anxiety is not isolated. It mirrors in the child. Higher parental anxiety predicts greater postoperative pain scores, longer hospital stay, and an increase in readmission risk. Beyond the numbers, children of distressed parents are more likely to experience nightmares, fragmented sleep, and separation anxiety that can linger weeks after discharge. In short, parental distress is a modifiable risk factor that directly influences clinical outcomes.
When a parent's cortisol spikes, the child's nervous system often follows suit. The resulting sympathetic surge heightens pain perception, forcing clinicians to increase opioid dosing, raising the chance of respiratory depression and delayed emergence. Autonomic dysregulation also slows gut motility, delaying oral intake and extending length of stay. Behaviorally, the child may develop sleep disturbances, recurrent nightmares, and heightened separation anxiety, all of which impede healing and increase the workload for the care team. Recognizing this cascade underscores why early intervention matters.
The first line of defense is preoperative education. Provide families with concise, illustrated leaflets that outline the surgical timeline, anesthesia plan, and postoperative expectations. Pair the leaflets with short, captioned videos that walk the viewer through the holding area, the monitors, and the gentle voice of the anesthesiologist. Whenever possible, offer a brief tour of the preoperative suite. Seeing the environment demystifies the unknown, reduces anticipatory fear, and gives parents a chance to ask concrete questions.
Child Life Services take education a step further. Age-appropriate dolls, mock surgical kits, and interactive games let children rehearse the procedure while parents observe. Some centers use virtual reality walkthroughs or tablet-based modules that families can replay at home. Storytelling, framing the surgery as a heroic quest, shifts the emotional tone from threat to adventure, reducing both child and parent anxiety.
Allowing a parent to stay for induction provides a secure attachment figure, dampening the child's stress response and giving the parent a sense of agency. Brief coping skill training, deep breathing, progressive muscle relaxation, and guided imagery delivered in the pre-op clinic equips parents with tools they can model in real time.
Even with education, some families remain highly distressed. Nurses can screen quickly using observable cues, rapid breathing, trembling hands, clenched fists, or a brief tool such as the Hospital Anxiety and Depression Scale, HADS, short form, or a 0-10 visual analog scale. Scores 8 and above flag the parent for a focused conversation. Documentation in the electronic health record ensures the whole team is aware.
Effective communication starts with empathy and validation. Use statements like, "I can see how overwhelming this feels. Many families feel the same way." Pair validation with concrete information. Explain exactly what will happen in the next 10 minutes, who will be present, and how the child will be monitored. Maintain open body language, steady eye contact, and a calm tone. Avoid dismissive phrases such as "don't worry." Instead, say, "We'll give a small dose of medication now," and watch his alertness closely. This transparency reduces the mental bandwidth parents spend guessing, allowing them to focus on supporting their child.
When distress exceeds bedside reassurance, offer tangible resources. Provide a one-page handout that lists Hospital Child Life Services, local parent support groups, in-person or virtual, 24-hour psychosocial helpline, social work contact for financial or logistical aid. If the parent expresses interest, arrange a brief meeting with a psychologist or peer mentor before discharge.
In summary, parental distress is a measurable modifiable factor that directly impacts a child's pain, recovery speed, and emotional well-being. By integrating targeted education, child life preparation, parental presence, rapid screening, empathetic communication, and concrete support resources, we can ensure smoother surgical journeys for children and their families.